After surgery, your body goes through a tremendous amount of healing. While you are focusing on recovery, you might notice something else causing discomfort. That is right, we are talking about constipation, a very common, yet often unmentioned issue. The main drivers of post-surgery constipation are primarily related to the effects of anesthesia, the use of certain pain medications, changes in your usual diet and activity levels, and the overall stress your body endures during the recovery period. So, why exactly does this happen? First, anesthesia has a temporary but significant impact on your digestive system. It essentially puts your bowels to sleep, slowing down the natural wave-like contractions that move food through your gut. Secondly, many of the powerful pain medications often prescribed after surgery, especially opioids, are well known for their constipating effects. They directly slow bowel movements and reduce the secretions in your intestines, making stools harder to pass. Furthermore, your activity levels are often greatly reduced after an operation. Lying in bed or being less mobile means your digestive system also slows down. Think of it like your body needing movement to help keep things flowing internally. Dietary changes also play a big role. You might be eating less fiber, drinking fewer fluids, or consuming foods that are not part of your usual routine, all of which can contribute to a backed-up system. Even the emotional and physical stress of undergoing surgery and recovering from it can impact your gut. Our digestive system is very sensitive to stress. And, in some cases, the surgery itself, particularly if it involves your abdomen, can temporarily shock your bowels, leading to a condition known as ileus. This means your intestines are temporarily paralyzed and cannot move food along. While many factors contribute to post-surgery constipation, there are practical steps you can take to help. Staying well hydrated is absolutely key. Drinking plenty of water and other clear fluids helps keep your stools soft and easier to pass. Gentle movement, if cleared by your doctor, such as short walks, can stimulate your bowels and encourage them to wake up. When permitted, gradually reintroduce fiber-rich foods like fruits, vegetables, and whole grains into your diet. And always remember to talk to your healthcare team about your bowel movements, as they might recommend stool softeners or other medications to help keep things regular. Understanding the difference between simple constipation and a more serious condition like a post-operative ileus is very important. While both involve a lack of bowel movements, an ileus is a temporary paralysis of the bowel itself, often requiring medical intervention, whereas constipation is usually due to delayed transit of stool. Always inform your medical team if you are experiencing severe bloating, abdominal pain, or have not had a bowel movement for several days after surgery. This allows them to assess your situation properly and rule out any complications. Recognizing these distinctions empowers you to be a more informed participant in your own recovery. By understanding these main drivers, from the effects of medication to reduced activity and dietary shifts, you are better equipped to anticipate and address post-surgery constipation. Proactive measures like maintaining hydration, gentle mobility, and smart dietary choices, alongside open communication with your healthcare providers, are your best allies. This knowledge helps you navigate your recovery with greater comfort and confidence, allowing you to focus more energy on healing and returning to your normal self.